Hi, my name is Sarah Skinner. This is my personal development plan for the unit Professional Capacity Building NCS 3201. This presentation is based on a personal development plan. This plan aims to develop and manage specific goals, identify required skills, and enhance competency development. These aspects are all key elements that need to be discovered in order for a goal or dream to be achieved. Throughout my presentation, I will be discussing my dream job, which includes rationales behind my chosen career, where I plan myself being, and the current need for this profession. I will then be discussing a SWOT analysis. This will involve my strengths, weaknesses, opportunities, and how they could impact my chosen pathway. I will then be discussing 5 SMART learning goals that I have set myself to achieve in 5 to 10 years. I will then be discussing 5 peer-reviewed literature that will support my chosen career and be used in my report. A conclusion will then underline the highlights of my presentation and conclude my development plan. References and sources that I have used in guiding me in this presentation will also be provided. So, my dream job. My dream job is a midwife. Since I will have my registration as an RN, I will be then considered a registered nurse midwife. This way, if I choose, I could work as both professions. A registered nurse midwife is a registered nurse with additional training as a midwife who is certified to deliver infants and provide prenatal and postpartum care, newborn care, and some routine as gynecological exams of women. I have a passion for all aspects that surround pregnancy and the challenges that a woman encounter. I have always had a strong passion for nursing and originally went down the pediatric nursing, specialising in neonates. The passion developed when I completed 2 weeks international placement in a rural setting as a Stage 5 student. Through this placement in the Philippines, I was lucky enough in assisting in 2 natural births. This experience was an amazing eye-opener and left me inspired in pursuing this career. I also assisted in maternal clinics where we provided education sessions, physical assessments, and provided general assistance and well-being to the mothers and infants. So, how would I get there? So to further my studies as a midwife, I would need to do a postgraduate, which at ECU, it is called a Masters of Midwifery Practice. This course is 18 months long. So the importance of this profession. Midwives are needed in many different environments, communities, hospitals and clinics, and women and infants require specialty care. So the salary of this position, the starting point is $32,800 per annum. This obviously is the starting point, and you can work your way up with experience as well. Okay, so this is my SWOT analysis. So as I said before, a SWOT analysis consists of 4 aspects: your strengths, weaknesses, opportunities, and threats. So my strengths. I am caring and have an empathetic nature. I work well in a team environment and I have a strong work ethic and effective communication skills. In my current job as a disability support worker, these 3 strengths have been developed. Working in an environment is very important, as well as showing a caring nature to help the residents that I care for improve their rehabilitation process. Having strong communication skills also help the residents in their rehabilitation process and gives us a therapeutic relationship to work on. I also have the experience in working in a rural setting. This has given me the opportunity to witness more natural and hands-on labour experience that I will aim to add on. I also have exceptional ability to learn and willing to overcome any challenges that may arise. So my weaknesses. At times I may lack confidence in my ability. I also would be studying full-time as a student, which may be financially difficult while completing my masters. I also tend to feel intimidated by higher authority positions. These two personal weaknesses that I have stated will be improved on as experience and knowledge develop. These two are challenges that I am prepared to overcome. Opportunities. There is an increased growth in population, which then increases the number of birth assistance that's needed. Being an RN with at least 2 years experience before starting my midwifery will enhance my clinical knowledge and improve my confidence. Also, there is a range of different areas to work in as a midwife. Threats. So being a young midwife or registered nurse may be a negative aspect to some patients and healthcare professionals. I feel that being a young midwife, I will have a stigma attached that I am not experienced enough. There are also less midwifery job vacancies compared to registered nurses. Now, these are my goals. These goals are based on the SMART tool, which stands for specific, measurable, achievable, realistic, and timely. So my first goal is to gain more confidence and knowledge while completing my 6 weeks rural placement in Kununurra as a Stage 6 student. The competency that I'll be using while completing this goal is critical thinking. This competency that I'll be using in order to complete my goal would be being able to put my theory into practice while being out of my comfort zone. My second goal is to have my registration from AFRA and start my graduate program at Hollywood Hospital commencing in 2016 and completing in August 2017. Professional practice will be used while completing this goal. While performing nursing interventions in accordance with recognised standards of practice. My third goal is to commence my Masters of Midwifery at the beginning of 2018, full-time for 18 months, and being able to graduate in 2020 as a registered nurse midwife. Collaborative therapeutic practices will demonstrate empathy, trust, and respect for the dignity and potential of the individual or group, which will be the mothers and families. Goal number 4. I would be employed as a midwife in a clinical setting in the year of 2010. Professional practice will also be used while completing this goal. I will be performing nursing interventions in accordance to the recognised standard of practice and critical thinking and analysis. So my last goal is working in a rural setting as a registered midwife, whether this is rural Australia, internationally in a rural community. this goal will be completed when I personally, mentally and financially feel prepared to. I will then demonstrate provision and coordination of care. So I would collect data that relates to the physiological, psychological, spiritual, socio-economic and cultural variables on an ongoing basis. Okay, so I have 5 literatures that I have used to back up my chosen profession. The first article that I read is called The Known and Trusted Midwife. This article is about the journey a mother and family go through during labour and how important it is for the midwife to develop a therapeutic relationship that is based on trust with the mother. Childbirth is an intimate and also intimidating time for everyone involved. The mother and the midwives have to learn to trust each other in order for the journey to go as smoothly as it can. The second article, Nursing for Women's Health. This source is a general article discussing what the profession is and what benefit it offers and how important midwives are to mothers and families involved in the pregnancy. The Association of Women's Health Obstetric and Neonate Nurses is mentioned throughout this article, addressing how they provide support to midwives and independent providers of healthcare services to women and newborns. Benefit and challenges of a Nurse Midwife Fellowship. A review of the Nurse B Stifel Fellowship Program at the Midwife Centre for Birth and Women's Health. This article focuses on the program located in Pittsburgh, Pennsylvania. This program is to provide experience for graduate nurses and midwives to gain hand-on skills and knowledge in the only freestanding birth centre in Pittsburgh. This article outlines the bridge that student midwives and nurses face between their education and the lack of clinical practice. The benefit of recruiting soon-to-be graduates enhance their clinical skills and provide the clinics with an extra pair of hands that are needed. My fourth article, Concrete Midwifery. This source focuses on the healthcare industry in Poland during the 1950-1980s era. This was a major baby boom area and there wasn't enough midwife or health professionals or resources to deal with this boom, which led to mothers having a negative view on childbirth. Some patients described their feeling as humiliating, a lack of empathy by medical personnel, including midwives. As a result, new standards of perinatal care and birth care were introduced, allowing families to be present at births, skin-to-skin contact, baths in the delivery room, and pain management. Paulina is a student who has implemented a project to keep deaf mothers who she feels would experience these exact feelings that were felt previously. The last article, Midwife's Labour and Birth Handbook. This book is a support reference and guide for midwives that provide evidence-based practice to develop their knowledge. So in conclusion, to summarise my presentation, the important part of setting goals and future admirations is being able to achieve your dream. Identifying your own personal aspects that could influence and affect your dreams is a great way to implement any changes that are needed. My dream job was always to be a nurse, and with the experience and knowledge that I have experienced has helped develop into the love and interest of midwifery. So these are my references that I have used. Thank you for listening to my presentation.